So I am a food scientist, that's my basic. And I took my master in industrial engineering. And for the last 11 years, I've been working as a project manager in Marel, which is a global provider of food processing systems. So I'm working all over the world. But recently I decided that I needed to do something else. And I was really happy when Landspitali was working for a site manager, because I really feel that here I can make a difference. So I started here in November last year. Landspitali is the biggest hospital in Iceland. We have around 650 beds. It is located in 11 locations over Reykjavik, so we have a big challenge in moving food around. Around 70% of all food that we make in our kitchen is moved to other locations with cars and trucks. And we are both serving patients on plates, and that's about 80% of our food is served on plates. And 60% of all food that is made in the kitchen is shipped with gastro, with trucks. So that's both food for patients and staff. So we're serving 11 canteens. What is happening in Landspitali now is that we are building a new treatment center, and that gives us a big opportunity, because that means that we will have bigger space for the kitchen, and the kitchen will be totally renovated, and we need to think big and make sure that we are working towards the future. What we are doing in Landspitali today is that we have a 5-week menu cycle, so there is a lot of recipes. We have 34 diets. We have 6 types of general diets, 3 types of general diets with changed textures, 4 types of liquid diet, and then all kinds of special diets. And as I mentioned, what we are starting here in Landspitali is to build our vision, and we need to look into that to work towards our future goal. And it really matters to us what we are working on today can be used into our future vision. Our biggest challenge is to get involvement from staff in the clinical departments, and also to make sure that the patients have a voice in our future strategy. And we really got a lot of information into this when we visit one of the hospitals that we did now in January. So that was really gave us a push that we should keep them involved and try to get them more involved than we have been able to do. So what we are doing today to try to get involvement is that this year we are trying to get the involvement of all the staff in the kitchen. We are trying to let them know that they have a voice in our future strategy. So every day we have a meeting. We put all the people in the kitchen into one room, and we have this meeting where we go through everything that we've been doing through the day. We have our numbers, if we can say so. Then they can tell what have been going wrong between departments. We have given people applause for what they're doing great. And we talk about our improvement projects. And then we have also like a department meeting. So every morning we start with the board to go through the day. And then we make sure that every improvement project that we do is done with this A3 methodology. And we try to make sure that all the projects are towards our future vision. But my big challenge when I started here in Landspitali is that I was really new to this hospital environment, as I said before. And living in an island, Iceland, where we only have one big hospital, and our kitchen is the biggest hospital kitchen in Iceland. That was really a challenge. We did not have any specific cooperation kitchen around the world. So when I started to ask around here in Landspitali, I got in contact with Paula through our environmental specialist, Hilda. And she has been part of healthcare without harm for some time. It was great to contact Paula to see really But she really put effort into helping me connecting with other hospitals, and that was a really, really appreciated job from Paula. And what we did then is that we were 3 from Iceland that visited 3 hospitals. We visited Radboud in Netherlands, Hvidovre in Denmark, and Feyser in Sweden. All these locations did a great job sharing with us what they were doing and gave us a lot of ideas for our future vision and strategy. When we got back home to Iceland, we were able to share with our co-workers what we did, and I'm constantly still showing them pictures and discussing what we saw. Because my staff is talking a lot about what we can't do, but we need to make sure that we're doing everything we can, and that's our job, to put the power to make sure that we think they can try to use the opportunity we have here in Landspitali during the next years to make good changes for the future of food in our hospital. And the 2 hospitals, especially Radboud and Hvidovre, they are really thinking big, and that gave us a lot of, spirit to try to be as big and think big as they are doing. That's all I have for today. So if you have any questions or...
Hello, Sigrun. Thank you very much for your presentation. I actually have a question for you, and this would be actually perfect to introduce our next speaker, which is Manon, clinical dietitian at Radboud University Medical Center in the Netherlands. So my question for you, Sigrun, will be, can you maybe explain further what did you gain from your visit to the Netherlands, and how actually this experience contribute to your own strategy, and maybe explain as well what was the best idea that you got from them or caused a bigger impact on you?
Yeah, what we saw in Netherlands was really, it was a really beautiful project, if we can put it that way. There was a great work between the kitchen and the provider of the food. They had a really good relationship, and they had done a lot of work with each clinical department, and as they told us, they made everyone feel like they were special. I think that's really the key, because we have a lot of special clinical departments in each hospital, and also that they gave the patient a voice in their team. I think that's a really what I brought home from the Netherlands. But what we also brought home is the hospitality they gave us. You really felt that you were welcome when you walked in their door. So that was, for me, also a great thing to see. And of course, it's really inspiring to see their food strategy. It's just how they serve the meal, how just all the little things that they put into the food. It was really great to see it. You did not feel like you were in a hospital when you were looking at the food.
Excellent. Thank you very much, Sigrun. So I think this is actually a best introduction to Manon and the work they are doing in Radboud. So please, Manon, when you want.
Hello, everyone. Good afternoon. Thank you a lot, Sigrun, for all the compliments you gave me of us with our food project we are doing some years now. Let me introduce you. I'm Manon van den Berg. I'm team leader nutrition at the Radboud UMC and also clinical dietitian and researcher. And today I would like to tell you about FoodforCare, an innovative meal service we developed. But first, in many hospitals, meal service is an underexposed aspect of care, and regularly hospitals have small budget for hospital meals. And it's often the subject of cost saving. So it's, I think, very important to make clear what the impact of food can be. So what is the actual role of the hospital meal service? Of course, nutrition is a necessity of life, and it seems to be an important issue in overall health and vital for recovery. But what is healthy? Many patients need extra protein and energy due to malnutrition risk during hospital stay, but also other patients should use foods rich on vegetables, fruits, and fibers to prevent comorbidities and welfare diseases. And then we have the special diets like salt-restricted, gluten-free, food allergies are also essential in some cases. So a varied offer of hospital food should be taken into account. Besides, patient satisfaction regarding meal services is of great value because it increases nutritional intake, and patients look forward to meals as a break from daily care. The appreciation of meal services largely determines the general patient satisfaction, so this can be a business card for hospitals as well. So where do we come from? To give you a look inside, these were the meals which we prepared in our hospital before FoodforCare. And as you can see, the meals didn't look nice, they didn't taste nice, and they didn't smell nice as well. They were overcooked, and it didn't stimulate patients to eat. We also received complaints from patients about the hospital food, so we should do something. And that's where we started our food dream team. With patients, dietitians, and the Department of Logistical Services, a food designer and a caterer, we talked about and we shared wishes regarding taste, smell, portion size, diet, healthy foods, logistics, information, sustainability, and also waste. And that's where we came to FoodforCare. So what is FoodforCare? Actually, it's eating and drinking is an essential part of patients' well-being. FoodforCare provides tailor-made solutions for hospital specialism and patients for each diet by providing 6 to 7 meals rounds per day with a choice of 2 to 3 dishes. We actively offer protein and energy-rich dishes, which is generally the basic menu. And nutritional assessments advise and encourage and nudge on the best choices. We use fresh, pure ingredients and with optimal nutritional values, and we already developed more than 700 dishes. And we were able to reduce food waste, which I will show you later. So, looking at patient satisfaction, we showed that meals were appreciated by 8.5, and food service was appreciated by 9.5 after introducing FoodforCare. Besides, we did some research on FoodforCare before implementing this novel meal strategy. As you may know, malnutrition is frequently seen during hospital stay in about 2 to 38% of the patient population. We know that malnutrition has severe consequences like reduced recovery, increased complications and infections, and a longer hospital stay. So we should do something about that. That's where we started our research question, and the hypothesis of our study was that FoodforCare will lead to an improvement in protein and energy intake according to protein energy requirements in clinical patients. Therefore, we We performed a quasi-experimental study in medical and surgical patients, where we first offered the traditional meal service in around 300 patients, and after stepwise introduction per ward of FoodforCare, we again evaluated the meal service in around 300 patients. And we specifically looked at food intake, nutritional status, and patient satisfaction. The primary outcome was the mean percentage of protein and energy intake relative to requirements. So, looking at the results, we were able to find that in the FoodforCare group, the mean reached protein requirements were 79%, where the traditional meal service reached 59% of the mean protein requirement, which was a significant difference of 19% in favor of FoodforCare. These were the findings on day 1. On day 4, we found similar findings, like 70% of the mean reached protein requirement in the FoodforCare group and 59% in the traditional meal service. Looking at the energy requirements, the FoodforCare group was able to reach 88% of the mean energy requirements compared to 70% in the traditional meal service, which was again a significant difference of 18%. And also on day 4, we found similar results, like 11% difference between FoodforCare and the traditional meal service. Besides the research, we looked at food waste, and up till now, after implementation, we managed to reduce food waste from 37% to 11%. By looking into the different levels of food waste, which I will show you in a minute how we did that. Also, 42% of our purchase has a sustainability label. Here are the different levels of food waste, looking at the production of food and looking at the hospital food waste. We saw that storage waste under A was based mostly on preservability, which was very low. Then we had production waste based on cutting loose and residual products, which was also already very low. Then we looked at the kitchen waste in hospitals, which is based on dishes that have been exceeded the preservation of 2 hours. And we saw that was the highest amount of food waste, and under D, the waste after service. So what was eaten by the patient, and by evaluating this, we were able to analyze in which parts of waste improvement still can be achieved. So this is a continuous process to look in optimization of food waste. Then I think future challenges in sustainable healthcare of food are substituting animal proteins to plant-based proteins, which are really helpful to decrease environmental load, but also to stimulate health in general by reducing meat intake. To achieve protein requirements in patients who are at risk for malnutrition, high amounts of high-quality protein are needed, and by choosing plant-based proteins, you need more volume. So that would be a challenge coming years, basically because patients are not used to a higher percentage of protein, plant-based protein. So it should be attractive and it should be accepted by patients. So that's, I think, is the goal for the coming years. So actually, This was my presentation, and I hope it's all clear for you. If you have any questions, I would like to answer them. Thank you for your attention.
Thank you very much, Manu. As you will see later on, she has also a link to her project, FoodforCare. I totally recommend to see it, even though it's in Dutch, but it will illustrate very well what you have just listened. I'm gonna pass the word right now to Christina. Christina is the director of the kitchen manager at the Hospital Hietzing Neurological Center Rosenhügel in Vienna, Austria. So please, Christina, welcome.
Hi everyone, I hope you can hear me. My name is Christina and I'm delighted to speak today about the Vienna Hospital Association and the Hospital Hietzing I work for. Further, I am the coordinator for sustainable food for the whole organization. First, I want to give a general overview about the Vienna Hospital Association. We are a large healthcare organization with about 11,000 beds, 8,000 beds for inpatients in hospitals, and around 3,000 beds for residents in nursing homes. All hospital kitchens have been certified in organic food, and they are allowed to print this label on the menu plan since 2008. You see a proportion of organic food from the whole organization. Currently, the average of organic food is about 35%. That is increasing between, we had declines because price raises and budget cuts had forced us, and so we needed time to find new ways. In general, our sustainable food strategy consists of the following aspects: seasonal, regional, organic, and a balanced use of meat. We have been working for many years to reduce waste in bread and bakery products. You see a selection of our important nutrition projects in relation to food waste and sustainability. There are two very essential ones. For the last 8 years, we have been working with Natürlich Gutteller and Umbesa. Both support the sustainable use of food in large-scale kitchens with a focus on vegetarian dishes. The activities of our food waste projects were different. Perhaps one alone would not be successful. Several together already. We work with the staff canteen as a compensation for the food quantities. We have a big focus on reducing bread discards, and we are interested in promoting the exchange of information and securing a communication basis with our departments. What are the needs, expectations, and wishes of patients when they come to the hospital? The core needs of patients are freedom from fear and pain, and as well privacy. This is a great responsibility and chance to make a good mood with our high quality food to our patients. However, there are different reasons why patients do not eat. There are medical reasons like nausea, vomiting, fatigue, loss of appetite, motoric restrictions, dysphagia. There are personal feelings like optics, taste and smell, and also medical examination or surgical preparations. You see a chart about an analysis of the Nutrition Day. More than 40% of patients say that they did not eat at all. This is really alarming, and it has a big impact on food waste because the decision if patients eat or not is taken at the mealtime. So it is too late for correction. We use a daily food and drink report for each patient. This is a measure to check up and evaluate, especially for malnourished patients. We do this not in all of our hospitals, but in Hietzing as well. As you can see, in recent years, our efforts against food waste have been effective. Why do we think we need a monitoring system for food waste? On one hand, we have international specifications, such as the Milan Urban Food Policy Pact, which was signed from our former mayor in Vienna, and the UN Agenda 2030, especially the SDGs number 12. On the other hand, there are commitments and so-called role model function for the whole organization. The whole Vienna Hospital Association has participated with other organizations in the initiative United Against Waste since 2017. As you can see, if all 3,000 companies in Austria with large kitchens took part in the initiative, how many savings would be possible? Savings were already achieved also in the pilot project. Food waste monitoring in large-scale kitchens, how does it work? It's an easy data collection with two key figures monthly. Food waste quantities and output menus are compared. Now a few words to the procurement of food according to ÖkoKauf criteria. ÖkoKauf is a program in Vienna for all municipal departments, and it develops standards for sustainable procurement. One of them is the working group Food. Their members develop tools for purchase of sustainable food in public institutions of the city of Vienna, like kindergartens, schools, hospitals, senior and nursing homes, and as well as for their employees. We had an internal and external promotion of healthy nutrition, and there is an indirect impact about ÖkoKauf work for the whole city in case of nutrition goals. As you can see, our nutrition pyramid is not the same what the people are eating. It's a wrong nutrition and a lack of movement. Too little vegetables, fruits, and whole grain products, and too much meat and meat products, sugar and salt. This is the actual consumption of food in comparison with the Austrian food pyramid. Men on the left and the woman on the average on the right. A little overview of current activities in the Vienna Hospital Association. We had a sustainable food plan in all hospitals. As a medium term increase is the increased implementation of plant-based dishes. We shared the presentation and information of our activities inside and extern. We had a process management for the food supply and development of an emergency management within the framework of non-clinical risk management. And also we are working actually on a guideline for malnutrition for the whole association. Yeah, so you find my contact in connection. If you have questions, you are welcome to let me know. Thank you for your attention.
Thank you very much, Christina, for your presentation. It's been a really interesting overview of the work that you are doing at the Vienna Hospital Association, and I think we are all looking forward to see what is coming in the future. I'm gonna address now some questions from our participants. In any case, I'm gonna leave you here on slide with the email addresses of Sigrun, Manon, and Christina, so you can maybe after the webinar as well can get in contact with them for any particular questions you might have. So, Sigrun, we have actually a question for you from Hania Alatas, that is wondering what kind of strategy do you do to prevent food waste in Landspitali?
Yeah, there has been ongoing some projects regarding food waste here, and they all started before I joined, but there is a great work in regards to, how do you say this in English, we are throwing away like plastic separately, and so we are doing, I don't know how to say this in English.
Yeah, to sort the different.
We are sorting the waste, but then we are constantly doing some projects. We have been we are, for example, now looking especially into our canteens because we have been throwing away a lot of things there. So now we are doing a project there. We also see that the waste from the patient is going up because we are measuring all the waste that is taken away from the kitchen. So we have seen the numbers rising for the last months. So now we need to start a project there. So we are basically measuring and taking pictures of what are being delivered at the moment. But we have not made any we have not done anything about it yet. We are just in the phase of getting information to us, and then we need to make decision on what we will do, what we will change.
Yes, thank you, Sigrun. I mean, measuring is of course the first step to take, and then from that once you know the situation as well, kind of like go into the solutions.
Yeah, this is something that we need to constantly be doing. This is done every once in a while, and every time we see it raising again, we need to do it again and again and again. It's never an end to this, I think.
Yeah. It's an ongoing process, so good luck with that. Our next question will be to Manon. The question is coming from Ian Stanton, and he wants to know if the new menu has increased protein and energy content per meal, and how this compares to the extra nutrition you got from the meals, being more appetizing. Anna, are you there?
Hello, Paula? Oh.
Yeah, we can hear you well.
Paula, could you please repeat the question?
Yeah, sure. So Ian Stanton is asking if the new menus have increased the protein and energy content per meal, and if so, how did it compare to the extra nutrition they got from the meals being more appetizing?
If I understand the question right, the question is if other components of the meals are different between the traditional meal service and FoodforCare? Is that correct?
Mm-hmm. Yeah, that's my understanding as well.
Yeah. In our research, we especially looked at protein and energy intake because that was our main goal to increase with the view on malnutrition in our hospital. That was we weren't able to treat our patients with malnutrition optimal, so that was our main goal. And by doing so, we looked only at energy and protein intake, and we left all the other components because it would be too big to look at. Actually, we have these data because we looked at the nutrients of recipes, so we could look into that if we would like to do that again. Is that an answer to the question, maybe?
Yeah, it is. Thank you very much, Manon. So, Christina, the next question will be for you. Can you tell us how much money you have invested in the procurement of more organic products?
We have no more money for organic products. We have a budget per year, and we find ways, I think, to do both. We had an average of 41% in Hietzing since I think 2014, and I get no more money if I buy more organic products. I do it like I do it, and we have no more euro for organic food.
Okay, thank you, Christina. So probably ask one last question to Sigrun about which steps did you follow to create your interdisciplinary team to participate in building your strategy for food in Landspitali? How many people are you in total, and how many times do you meet? Which are the main activities?
Yeah, this is basically our next step. We haven't built this team yet, but after our visits and what we have seen, to make this really go through and to make sure that our patients will in the future get served and get the correct attitude, we need to involve them. We haven't really done it. We are just starting to build the teams. So we haven't. We haven't really done the plan on how often we will meet or anything like that. Now we're just working on getting all the kitchen staff involved, and our next step is to get the clinical staff and other players and the patient with us into the team, and then we'll build how many times we will meet. If we will just have a couple of work scenarios, or we will meet on a regular basis. Yeah.
And thank you very much, Sigrun. Please keep us informed about the following steps of this interdisciplinary team. I'm gonna now actually conclude this webinar, but please, if you have more questions addressed to our speakers by email or either to me. So just maybe as well, I'm gonna give 3 takeout messages of this webinar. Meal services are an essential part of hospital care in order to reduce malnutrition rates and food waste. Also, you have to consider actually food as a business card for hospitals, and not only think a hospital as a place to treat yourself, but also to prevent and promote health. And also, I really like this idea of thinking big and work towards the future. So let's continue working, and thank you very much to our speakers and participants.